You may have some interest after taking courses on topics related to dental sleep medicine and craniofacial pain, and have started to understand or realize that there may appear to be some overlap in airway issues, bruxism, and craniofacial pain. Or you may want to start your educational journey in understanding airway, bruxism, and craniofacial pain based on failures or experiences seen within your practice while managing your patients. There has been interest in the relationship between sleep bruxism and sleep disorder breathing. Some clinicians have advocated assessment for possible sleep disorder breathing in patients with temporomandibular disorders, with an underlying assumption that patients with TMD caused by sleep bruxism may in fact have underlying sleep disorder breathing. So logical progression may suggest that treatment of sleep disorder breathing, which is assumed to be the cause of sleep bruxism, may resolve the pain associated with TMD. Let's journey through the various etiologies of sleep bruxism, as it has been suggested to be multifactorial, and also let us explore whether sleep bruxism and sleep disorder breathing coexist. Dentists need to be aware that current standard maxillary oral appliances to protect teeth from attrition may not be appropriate treatment in the presence of sleep disorder breathing. Come join us at one of our ABC courses and gain knowledge and wisdom from our experienced clinicians. Learn to understand the literature and draw sound conclusions. Challenge yourself with a pre and post test and understand your level of knowledge and fill in the voids that you have by participating in our courses. Visit us online at dentalwriter.com to view additional information and topics offered by Nierman Practice Management.